I'm Maddie, and today I will be doing my CVAD site care checkoff. So first I will check for my physician's orders, and then I will go into my patient's room. I will identify my patient using two patient identifiers for their name and their date of birth. And then I will gather all my supplies needed, and I will explain to my patient what I will be doing and why I'm there. And then I will perform hand hygiene and put on my gloves. Okay, and then I'm going to put on my mask. And I will also tell my patient to put on a mask or turn their head to the side so that they're not breathing on the side while I'm taking off the dressing. So now I am ready to go ahead and take off the old dressing, starting from the outer part and then working my way in. Okay. Now that's off, I'm going to just assess my site and assess the suture integrity while it's off. So now I'm going to remove my gloves and perform hand hygiene again. After I've done that, I am ready to go ahead and open my package. Okay, and I don't need this mask today, so I'm just gonna go ahead and throw that away. Then I'm going to get my gloves out and go ahead and put these on. I'm gonna make sure to abduct my thumb to maintain sterility. Okay, and then now I am sterile to sterile. So I'm just going to remove that. Then I'm going to take my drape out. Then I'm gonna lay out my chlorhexidine. I don't need this tape, so I'm just gonna throw that away. Then I also don't need that. Take my Tegaderm and my gauze pad. And I don't need this, so I'm just going to throw that away. Okay. And now I'm going to take my chlorhexidine. I'm gonna go ahead, I'm gonna use this to grab so I'm not breaking sterility. I'm gonna take my chlorhexidine and go ahead and just wipe around the area and also wipe on the line. Okay. And then I'm going to let that dry for at least 30 seconds. And once that's dry, I'm gonna go ahead and take my Tegaderm. I'm going to apply it. Making sure to get as much bubbles out of it as I can. Then I'm going to take my label and just label the dressing with my initials, date, and the time. Okay, and then now I can go ahead and take off my sterile gloves. I'm just going to throw all this away. Then I would perform hand hygiene again and then put on my non-sterile gloves. Oh, and also, after I did the chlorhexidine, I would have applied an antimicrobial patch, but for the purpose of this video, I did not have that, so I would not do that. And I would also do site prep if needed. Okay, now I also already have 2 prepped flushes for this video. So if they weren't prepped though, I would open it and then prime this one, but it is already primed. And so now I'm going to take my clave, making sure to maintain aseptic technique and not touching the tip of it. And I'm just gonna take this off. And this one is also already primed. If it wasn't, I would prime it right now. Go ahead and connect this. I'm just gonna prime the clave. Okay, now that that's primed, I'm just gonna set that to the side for right now. I'm going to take my alcohol wipe or prep pad, and I'm going to mop the top and scrub the hub of my clave for at least 15 seconds. And I would allow that to dry. Okay. Now once that is dry, I'm just going to go ahead and flush this, and I'm going to unclamp. And I'm going to flush at a pulsating or a like start to stop method. Remove that, put the clamp it back. Okay, now that I've done that and my new clave's ready, I'm gonna go ahead and take the old one off. Take my new one, remove this. Cap. I'm going to unclamp it again. I'm going to flush the new one at a pulsating method, clamp it back, remove that. And then I would apply an antimicrobial cap if I had one, but for the purpose of this video, I do not have one. So now I would just remove my gloves, perform hand hygiene, and then I would document per facility policy.